Hey, Dr. Wally here. There has been a lot of interest about the labiaplasty procedure, and a lot of people are asking who can have a labiaplasty procedure and what are the indications for it? Well, first off, the labiaplasty procedure is a surgical procedure done to decrease the length and volume of the labia minora tissue, which is hanging outside the vaginal area. And what I mean by that is that there's two portions of the labia that are in the female anatomy. There's the labia majora, which is the outer labia, and then the labia minora, which are the inner labia. And so people who seek a labiaplasty procedure want the labia minora decreased in size and volume. And the reason why they want to do that typically is that it is hanging too far out, and what happens is when they're wearing tight clothing, yoga pants, or exercise, it rubs, tugs, causes irritation. I had a lady just tell me that when she wears panties, her labias are so big they get twisted in her panties, and it's very uncomfortable and painful. A lot of people will tell you that sometimes in intercourse, the labias fold in and cause rubbing and tugging and irritation and pain. Another reason to consider it is that it is just irritating having that extra tissue hanging out. But whatever the reason is, typically it's because it is related to the volume and size of the tissue that is hanging outside the labia majora. And because it's hanging outside, it is prone to getting irritated, prone to chafing, prone to causing itching and other concerns. So the labiaplasty procedure is a procedure done to reduce the volume of that tissue. And there's two ways that we do it. One way is to do a straight line incision, which is typically just amputating the tissues that are hanging outside. The second way is to do something called a wedge excision, which is taking out like a pizza slice shaped portion of tissue and then bringing it together. The advantage of the wedge excision is that you get a more natural appearance to the labia minora. And over the last few years, there's been a lot more interest in the aesthetics of the area. So the old way to do it, which was the straight line repair, is losing popularity because more and more people want it to look as natural as possible. And the wedge excision is a much more natural appearing surgery once it's healed. And so I prefer to do the wedge excision because I think it looks more natural and it's more anatomic. A lot of people prefer that now, and so that is really the procedure of choice in my opinion.